This is going to be a shift correction series in standing. This is particularly useful for someone who we see has a little bit more tightness on one side of their pelvis and is hiked up like this, or even for anybody with back pain on one side that's just in the back or pain that's going down the leg. We use this as a test as well as then a treatment following the test. So if someone comes in and has pain on this side and their shoulders are shifted away from that pain, ultimately I want to get their shoulders back over this pelvis. So if I want to put more pressure to one side, I can use this wall as a shift correction maneuver. So I can do it with a straight arm. So starting off, feet side by side, arms straight, and my shoulder tucked down. One hand on my pelvis, and I'm going to let my hips just sag into the wall lightly. Now you see a lot of people want to go really far with this and they start getting a big bend in their elbow. Straight arm, it's not going to be a big motion, especially if you're stiff or you're in pain. That might be all the further you go. Now first thing I do is I typically have people check one side and they turn around and check the other side. And you see if one direction is less painful, or hopefully not painful, the other may be more uncomfortable. You're going to start with the direction that is less painful. So if I say this one feels good, I don't have any pain, and maybe the other one I did, I'll start here and I'll go nice and slow, as far as I can comfortably without any of this stuff moving. And I could almost use this hand to give myself a little pushing in overpressure if it feels okay. A normal sensation, if anything, would be a stretch on this side facing the wall, and back out of it slow. So in nice and slow, and if you start to get a little discomfort there, you get right back out of it, and see if as you do each follow-up repetition, can you go a little further? Does it feel like your motion is improving? But if you're doing this and it's getting more sore, you're having more pain, or you're starting to feel it go down your leg, don't do this. Maybe try the other side. If that's not working, then this isn't a good movement for you. Now, an alternative is going to be, instead of dropping my pelvis in towards the wall, focusing more on reaching up and over and lengthening. So you see with this one, as my hip goes in, I'm opening or stretching this side as I'm kind of compressing or closing down this side. I can do the same thing where I reach up and over. So same position, but instead of sagging inward, I'm going to take this arm up, and rather than really caving over, I'm going to reach up towards the corner of the ceiling. So I'm now lengthening this side and then coming back down out of it. So coming up to where my shoulder, and maybe turning my hand so that my thumb is facing backwards, and then a reach up and over, not necessarily trying to crash to this side, but more elongating this side. This is another good way to work on that asymmetrical tightness. Same thing, picking between the two sides. So you see the other side, same thing, arm coming up, and then more of a reach up and over. I'm actually trying to reach up and touch the ceiling and back out of it. Now, a couple important pieces that I throw into this one in particular is, if it feels okay, coming up and trying to take a deep breath in as I reach, pushing air into my ribs on this side, and exhale. If I want a stronger stretch, I can take my feet from the side-by-side position and go a little bit more staggered. Some people will get maybe a better stretch with the foot in front because it'll pull more from the back side. If I switch it around and my trail leg's behind me, it's going to pull a little bit more on the front of my hip. So these are all little variations to pull at different parts, but it's all based on trying to lengthen one side of your spine or pelvis.